Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and we're here with Eli again. Eli is just towards the mid to end point of the college football season, so we're getting him tuned up. Had tough practices out in the cold, and Eli, why don't you just tell us a little bit about what's bugging you today?
Yeah, so neck's a little bit stiff and upper back, and then hips, mostly from, I think, the cold practice yesterday.
It's been, 20 and 30 degree weather out there, so he's a wide receiver, going and diving for a lot of balls, landing in kind of awkward positions, and then obviously getting hit on a regular basis after the catches. Hopefully not too much, but anyway, we're going to just go ahead and evaluate. I'm going to motion palpate him and watch him move a little first, and then we'll go ahead and get him tuned up so he's ready to go for practice today. So, Eli, I'm going to have you just stand right here,
Okay.
and then we'll just check your neck range of motion by having your feet together. And then I want you to just look up and down as high as you can and look down as far as you can. Any pain or stiffness
A little bit on the left side.
on the left side?
Yeah.
And then I want you to turn your chin to the left and right for me. Good. How about with that?
A little bit on the left, not as much as looking down.
Not as much as looking down. Okay. And I'm going to have you go ahead and face me now. And then with your hands, let's just check shoulder mobility by having you go above the head and touch the opposite shoulder. Good. And now do the other side. Any discomfort in the neck or shoulders with that?
Not bad.
And then we'll do internal rotation going underneath and touching the opposite shoulder. Good. Anything there?
It was a little harder to get there on the right side.
A little harder on the right.
Yeah.
Let your arms just relax, and I'm going to have you turn your whole spine to the right and left one at a time. And the left. Anything holding you back there?
Going to the right felt like it was a little stiffer.
Stiffer?
Yeah.
And where did you feel the stiffness?
Just more like kind of through the side there.
Kind of through the side?
Yeah.
Okay. And then go ahead and just angle yourself this way a little bit and look down at your toes. Try to touch your toes. Any discomfort there?
Just tightness in the hamstrings.
In the
felt like.
hammies?
Yeah.
And then reach above your head, look up at your hands, and I'll have you arch backwards. Anything there?
No.
Okay. And then give yourself enough clearance from the table, but I'm going to have you do feet together and then do your squat with your feet flat. Back up. Anything there?
No.
No? Okay. All right, let's go ahead and lay or sit on the end. I'm going to sit behind you and we'll get started with the palpation. So we'll start in the pelvis and work our way up, and you just tell me if you have any tender spots here. So we got 2 regular season games left.
A little bit there.
A little bit right in there.
Back. Yeah.
And when I'm feeling that and I challenge at end range, that right SI joint is not moving. He's telling me it's tender, but it's definitely not as springy as it should be. So we'll challenge that left side too, get him to end range. Any of that tender?
More on the right side still.
Little restriction on the left with this, but definitely more pronounced on the right. We'll adjust both of those today. And then be at the sacrum. Any pain there?
No.
I'm going to come down a little bit. How about there?
No.
Not bad. Then we'll start working our way up. How
A
about
little
there?
bit there on the right.
His L5 is definitely limited. And then we'll work L4 too.
Yeah.
He's got good mobility as I get into the thoracolumbar region, like super springy. I'm not having to push through much at all, but as I get right into this mid-thoracic, he can feel that at about T6 level. You feel a little tenderness there. So I can lock him out at end range a little better. I'm going to have Eli go ahead and put your hands behind your head.
Okay.
And then you can just interlock your fingers, bring your elbows together, and lean on to me here. And then we'll keep working up the mid and upper thoracics. And this whole area is just super limited on him with extension. And we saw the rotation restriction when he was turning his spine. When he was standing, you can relax. And then now I'm going to get in, anytime we're dealing with a shoulder or neck, upper back region, it's important that we check the CT junction where the neck and the upper back meet. A lot of restriction here. Anymore, we're forward leaning society. We're on technology all the time, and Eli is just finishing up college and a lot of time looking down at a book or on a computer or on an iPad, and we got to make sure that's staying mobile. That tender.
Yeah, not left side.
A little bit on the right too.
Yeah, not as bad.
And we'll work through the cervical spine. Good. All right. Got everything identified that we need to work on. Mid and upper thoracic, CT junction, middle cervical spine. We got some stuff going on here, some restriction going on in the lumbar spine, lower lumbar spine, and the SI joints. So we're going to get those adjusted. Before I do that, I'm going to evaluate his hip range of motion, and then we'll get that adjusted as well and recheck everything and go from there, okay? Lay on your back. All right. And then I'm going to just bend this knee up. Okay, and checking flexion first. Any discomfort there?
A little bit right at the end.
Right at end range?
Yeah.
Like right about there?
Yeah.
Yeah, and I'm feeling that that's about where the blockage starts. And then when I take him into internal, that's a lot more restricted on him. Is that sharp or just kind of tight?
No, this side just feels tight.
Yep. And we'll bring his leg in a little further. That's, you feel that? That helped?
It helped a little bit with the tightness, I feel like.
Less tight?
Yeah.
No pinchy with any of that? Good. When it's pinchy, big concern, we want to make sure that that joint isn't rubbing, or that ball and socket of the joint isn't pinching with something like femoral acetabular impingement, which is that's a bigger deal. We work on that all the time, but I'm not suspecting Eli's a bone-on-bone patient here. He's just got some joint and soft tissue limitations that are holding him back. So, and that could be affecting the lower back with him. If those hips aren't as mobile as they should be, the lower back will a lot of times try to overtake that and make up the difference, and it's just not designed to do it as well. The hip needs to be a mobile joint. So how did that feel when I went up and in on this side compared to the right?
I think it's more painful, but I feel like I can get further almost.
Yeah, and I'd agree with you on that. Like at end range, there's more spring on this side than there was on the right. So, and then internal, how's that? Okay.
Still feels, yeah.
Similar
About
though?
the same as the right side there.
Good. Well, we'll start, I think, we're gonna, while I got him on his back here, we're gonna go ahead and adjust the hips first, and then we'll get you on your side and work our way up the spine, if that sounds good to you.
Yep.
And then I'm gonna just set the drop, and you just relax. All right. So we'll be right through here. Eli, you tell me if it gets pinchy at all with any of this, and then I'll back off a little bit, but we'll be right here. Little drop. That okay?
Yep.
This is something that we've been working on with Eli throughout the season. Eli, how's that, like, how have you felt making sure this is kind of the first time in your football career you've had regular adjustments and care? What difference did that make?
It feels like throughout a week of practice that I just stay fresher and I'm not as sore by the end of the week.
Yeah.
The game.
The recovery was a lot better for you. Good. A little bit there.
A little bit better, yeah.
Okay, and then I'm going to do a distraction on you this time, so hold the side of the table for me. No pinchy there. One more. Good. How's that feel?
Feels a lot better.
About there a little bit.
Yeah, a little bit.
Good. Okay. All right, hold the side of the table. A little pop here. Good. Okay. Recheck flexion. Feel okay?
Yeah.
Good. All right, Eli, I'm going to have you lay on your shoulder facing me. go. And go ahead, bring that up here, like that. Okay, you just relax and I'll roll you into me and we'll get that lumbar spine. Good. Okay, and we'll do the other side. And there we go. And then let's go ahead and I'm going to grab this. There we go. All the way down. And elbow over elbow. Take a deep breath in, and then we'll let it out. One more. And back up. All right, and then let's go ahead and have you on your back, and we'll get the neck through here. Good job. Just relax. One more. Good. Right there. There we go. Nice. Okay. We're going to get that CT junction. I'm going to have you go on your stomach. And then slide down a little bit further. There we go. Good. All right. All right, I'm going to have you turn your head this way. A little drop. And we'll lower that. All right. And then bring this hand down to your hip. There you go. Okay, and then switch. And again. Good. Come back up. All right, go ahead and stand here, Eli, and then we'll check your neck mobility first by having you look up and down. And then left and right. Good. Reach over your head with this hand, touch the back of that shoulder. Do the opposite. Good. And then reach underneath and touch the bottom of the opposite shoulder. And the right. Okay. I'm going to have you turn and face this wall. Feet together. Let's rotate your spine left and right. And the other way. Good. And then face this wall and we'll do the toe touch. Back up, reach above your head, look up at your hands, arch backwards. Great, and then let's check your squat pattern. Good, back up. How's that feel?
Good.
Yeah, how does it feel in the hips?
Yeah, hips feel good, neck feels a lot better.
Yeah?
Yeah.
Good. All right, well, hey, thank you for watching. If you liked what you saw, please subscribe to our YouTube channel. Eli, good luck on the football field this weekend, and we look forward to seeing you soon. Thanks.